You've done your general survey, but now the real cues begin to surface. As you assess the skin, face, and eyes, what if something doesn't look quite right? This part of the physical exam is full of subtle findings, if you know where to look. This isn't just about the skill, it's about recognizing the cues and asking yourself, what does this mean for this client? This is Mr. Robert Hayes. He's 65 and was recently readmitted for fluid retention after heart failure exacerbation. He's stable, alert, and says he's feeling just a little off. You're beginning the physical portion of your head to toe assessment, and that starts with the skin and nails because they're often the first place you'll see signs of changes in perfusion, hydration, and overall health. Start by observing the skin, what you can both see and feel. Mr. Hayes' skin appears pale and feels cool to the touch. Not cold or clammy, but definitely not warm. These are early cues. Pale skin might be expected in some clients, but when paired with what you already know about him, it raises clinical questions. Could this be a sign of decreased cardiac output? Is peripheral perfusion being compromised? Cool skin can also suggest fluid volume shifts, like fluid is moving out of the vascular space. Here you're applying clinical judgment, connecting what you see to what it might mean. Ask yourself, could this be early decompensation? Do I need to think about oxygen delivery or fluid overload? The skin often gives us the first clue that something inside isn't quite right. Next, examine Mr. Hayes' nails. They appear slightly spoon-shaped and pale, and when you press and release, his capillary refill is just over 3 seconds. Spoon-shaped nails, called koilonychia, can be a sign of iron deficiency, especially when paired with pale color. Delayed capillary refill suggests sluggish perfusion or low fluid volume. On their own, these may seem like minor findings, but you're not just documenting, you're connecting. Together, these cues strengthen your hypothesis. Could this be chronic anemia? Is his fluid status contributing to the delayed circulation? Subtle cues like this help you build a more complete clinical picture before vitals ever confirm a trend. As you continue the head and face assessment, check basic cranial nerve function, starting with cranial nerve 5, the trigeminal nerve. Mr. Hayes has symmetrical jaw movement and no reported numbness when you ask about facial sensation. That's a normal finding, but still meaningful, especially in older adults where stroke risk is higher. With cranial nerve 7, the facial nerve, you ask him to smile and raise his eyebrows. His movements are symmetrical but slightly slow, not abnormal, but worth noting in case future changes occur. Finally, with cranial nerve 11, the accessory nerve, you ask him to shrug his shoulders and turn his head against light resistance. He completes both with equal strength. Even when findings are normal, they help you establish a baseline and confirm intact function. What's normal today may not be tomorrow, and noticing that shift could change your plan of care. Now we're going to observe Mr. Hayes' eyes. His sclera appear dull and slightly gray, not yellow, but lacking their normal brightness. His conjunctiva look pale instead of the usual healthy pink. These findings can point to anemia or poor oxygenation, and while subtle, they're still important. Now check his tracking. He follows your pen light, but there's a delay before his eyes shift direction. It's not that he's unable to track, it just takes an extra second, like his eyes are responding slower than expected. That kind of sluggish movement might be related to fatigue, poor perfusion, early hypoxia, or medications like beta blockers. Combined with the other cues you've gathered, these findings make your clinical picture more complete. Cue by cue, your hypothesis is gaining traction. In just a few minutes, you've gathered a layered set of cues, and more importantly, started building clinical meaning behind them. Pale, cool skin? Possibly perfusion issue. Spoon-shaped nails with delayed capillary refill? Maybe anemia or even a fluid imbalance. Flat affect could reflect fatigue, hypoxia, or even emotional blunting. Pale conjunctiva, this points towards low hemoglobin. Dull sclera, this is a subtle sign of chronic illness. Sluggish eye tracking, maybe poor perfusion, hypoxia, or even medication side effects. None of these cues stand alone, but together they strengthen your working hypothesis. Is Mr. Hayes experiencing ongoing fluid overload, decreased cardiac output, or maybe even early decompensation? In our next video, we'll complete the head, ears, eyes, nose, and throat assessment with ears, nose, and throat, where even more subtle signs can help confirm or to redirect your clinical thinking. And remember, subscribe and hit that notification bell so you don't miss any of the episodes in this series.